Well, hello, everybody, and welcome to the Fasting Transformation Summit, where we are uncovering the most ancient and revered, inexpensive, and powerful healing strategy known to mankind, fasting. I'm your host, Dr. David Jockers, and I've got a great guest today. This is Dr. Brian Mowll, who is known as the Diabetes Coach. He runs Sweet Life Diabetes Health Center. He's the host of the Diabetes Summit and the Mastering Blood Sugar podcast. So whenever I think about diabetes, I think of my man, Dr. Brian Mowll, and we have got him on to talk about diabetes and fasting. So Dr. Brian, really great to have you on with us.
Thanks, Doc. Yeah, these are always great conversations. We've done a number of these together, and they're always a lot of fun and packed full of information. So I'm excited to dive in with you here today.
Absolutely. And so let's start with what the difference is between type 1, type 2, and type 3 diabetes.
Oh, great question. Well, type 3 diabetes is not an officially a type of diabetes. And there's another one that I'll throw in there, which is type 1.5, which is also an unofficial title. But type 1 and type 2 are certainly classified as diagnoses, and they're very, very different. In fact, they're completely different diseases. I almost wish they didn't share the same name, because the mechanism behind each of them couldn't be more different. So type 1 diabetes is an autoimmune disease, similar to something like rheumatoid arthritis or lupus or Hashimoto's thyroiditis, where the immune system of the person targets the pancreas, a specific part of the pancreas that makes insulin, and targets it basically for destruction. And autoimmune disease, the causes of autoimmune disease are many and varied and complex, but the end result here is that the person who acquires this disease or has this disease loses the ability to produce the hormone insulin, which is the hormone responsible for taking glucose out of their blood from diet and other sources and putting it into body cells to be burned for fuel. So when you have type 1 diabetes, which, by the way, is typically diagnosed in children or young adults, so ranges anywhere from just a few months old, typically somewhere in the 4, 5, 6 to 10 range, but then can also be diagnosed really all the way through young adulthood, 16, 17, 18 years old, and or early 20s. So that's the most common time to be diagnosed with type 1. It's an autoimmune disease, destroys the insulin-producing cells of the pancreas, leading to a deficiency in the hormone insulin, so you cannot control your blood sugar anymore. And you also can't control the dumping of sugar from the liver into the bloodstream. So you've got sugar flying into the bloodstream, which can become very dangerous and cause all sorts of problems. So the treatment for that is injecting insulin. That's really the only treatment for type 1 diabetes. Now, there's ways to help people with type 1 diabetes require less insulin, but they still will always need external insulin. Now, type 2 diabetes, completely different. Typically diagnosed in adulthood, so commonly 40 and above, 40, 50, 60 years old, although we are seeing younger people diagnosed with type 2 diabetes. In fact, that is why they changed the name. It used to be juvenile diabetes and adult onset diabetes, but we're seeing some of these lines cross where now kids, unfortunately, are being diagnosed with type 2 diabetes. And that is due to not a deficiency of insulin, but an inability to properly use the hormone insulin. And I don't look at type 2 diabetes as a disease at all. I look at it more like a dysfunction. The pancreas makes insulin like it's supposed to, but the body cells, particularly in the muscles, liver, and fat, no longer respond to the hormone insulin. So the net effect is that the body still can't get sugar into the cells to burn for fuel, so it still builds up outside the cell, and we still get high blood sugar. But there's a very, very long, usually, development period for type 2 diabetes. Now, again, I said it can happen in kids. Usually that's with sort of this unique set of genetic circumstances plus a really bad lifestyle with a highly processed diet, lots of sugar, overweight, obesity. But it can happen in kids. But typically, it develops over decades, 10, 20, 30, 40 years of damage being done to these cells and organs, which make them resistant or unresponsive to insulin, which leads to the problem. Now, there's also something called prediabetes, which is like the step before type 2 diabetes. It's the same cause, it's the same mechanism. It's just sort of a phase of a broken blood sugar metabolism before you get into the range where you're considered diabetic. And we can talk more about that in just a few minutes. But just to finish the answer, type 3 diabetes, what's typically called type 3 diabetes, is diabetes or insulin resistance of the brain. And there's a strong connection to Alzheimer's disease and really all forms of dementia, Lewy body dementia, vascular dementia. So when the brain becomes insulin resistant, there are all sorts of problems that happen. And it's been shown that the brain will build up these plaques, these amyloid plaques, and that can lead to dementia. It also interferes with the brain's ability to take in glucose and burn glucose for fuel, which can lead to cell damage in the brain. So type 3 diabetes has sort of become a name that describes the connection between Alzheimer's disease and other forms of dementia and blood sugar dysregulation, particularly insulin resistance. And then lastly, type 1.5, just to wrap up this segment, is a host of diabetes diagnoses that don't fit the other one. So there's something called LADA, which is the most common. That stands for latent autoimmune diabetes of adulthood. Similar to type 1, it's an autoimmune form of diabetes, but it affects adults rather than children, and it's much more slowly progressing. Now, this is important because many people will go to their doctor, be diagnosed with type 2, but their blood sugar skyrockets and it's not well controlled by diabetes medications. They don't seem to fit. Many times they're thin. They're not overweight at all. And when we then look at them a little bit more closely and run some functional medicine tests or some functional diagnostic tests, we find out that no, you actually have autoimmune diabetes, which needs to be treated completely differently than a typical type 2 case. And oftentimes that's missed by conventional medicine. So many different ways that diabetes can manifest in the body.
Yeah, absolutely. I mean, it's just proof that diabetes is a lot more complex than what most people think. And so what are some of the lifestyle strategies that you use to help people overcome diabetes?
Yeah, well, that's great. And that will kind of bring us into fasting, which is obviously the topic of this conversation. We will do things like, the lifestyle interventions that have been shown to be the most effective for blood sugar control, regardless of the type of diabetes. So type 1, type 1.5, 2, prediabetes, type 3 diabetes, is a low carbohydrate or ketogenic style diet. Glucose, which is the primary issue once you have diabetes, elevated glucose levels in the blood, should be minimized or eliminated, because obviously the more glucose you put in, if you're already glucose intolerant, which is another name for prediabetes or type 2 diabetes, the more glucose you put in, the more stress you're putting on the system. So we want to minimize the glucose coming into the body. Therefore, we want to minimize the carbohydrates coming into the body. So low carbohydrate diet has been shown time and time again to be the most effective dietary strategy for controlling blood sugar. Ketogenic diet takes it to another level, and then you have the added benefit of having ketones, which has been shown to be really effective for what we could call type 3 diabetes, which is the diabetes or insulin resistance of the brain, because it gives the brain that alternative fuel source, which burns actually cleaner and requires less energy and can actually be even more effective than burning glucose. And there's other benefits, of course, and I know your audience has probably heard lots about ketogenic diet, but that can be a really good strategy. And there's studies to back that up for diabetes and blood sugar control as well. So that's one. The second is obviously physical activity, and fitness is really important. Physical activity will help you to metabolize glucose better. It'll help to improve the way your body uses insulin. If you're type 1 and you require insulin, it'll help you to require less insulin, because exercise in an independent way helps your cells take up and use glucose without even needing insulin. So exercise is really important. So those are the two cornerstones. But then there's lots of other strategies. We get into things like improving sleep quality and stress, and strategies like supplementation and fasting can be really helpful as well.
Yeah, absolutely. And so it's really a full lifestyle intervention. And so let's talk about fasting. How does fasting play a role in helping somebody with diabetes?
Yeah, it's a good question, and it helps in different ways for the different types of diabetes. For people with type 1 diabetes, you have to be a little bit more careful with fasting. It can be used and it can be helpful. It's probably a little less therapeutically beneficial, but it still can be helpful. It really is helpful. In fact, can be one of the most helpful things for people with prediabetes or type 2 diabetes. So probably want to focus in those areas. Also, about 96% of diabetes is type 2, and prediabetes rates are 4 times that of type 2 diabetes rates. So when you look at the amount of people with prediabetes and type 2 diabetes, it's almost half the population of the US, at least a third, and almost half the population. So those two together really are a huge, huge issue. And that's where fasting can be so beneficial. So to understand how fasting benefits diabetes and blood sugar, we have to look at the kind of the mechanisms. And again, we talked about how type 2 diabetes and prediabetes is basically insulin resistance. So the cells have become resistant to insulin. And when that happens, the body raises insulin levels to overcome that resistance. And when your insulin levels rise, it does a number of negative things to the body. It causes basically a stress response. It causes an inflammatory response. It causes you to store more fat and basically shuts down your metabolism, your fat-burning metabolism. And it causes fluid retention in the kidneys, which raises blood pressure and causes other issues with electrolytes and minerals and so forth. So all of those things happen from high insulin levels. So this is why we see people with prediabetes and type 2 diabetes oftentimes are overweight, oftentimes have high blood pressure, and cardiovascular stress due to the inflammation. And you can see where all the complications come in: sexual dysfunction, kidney problems, problems with the small blood vessels of the eyes and the extremities, which can lead to amputation and blindness. This is all due to not only high blood sugar, but high insulin levels. And in fact, some researchers say the insulin is the bigger culprit. So what we want to do is we want to help the body become more sensitive to insulin, and we want to lower the blood insulin levels. Every time you eat food, no matter what food, you're going to release some insulin. Now, you're always releasing some insulin around the clock, basically a steady state of insulin, what's called your basal production, baseline production. But every time you eat food, you're going to go into a different phase of insulin production. You're going to release a small surge or a large surge of insulin based on what you eat. So if you're eating a lot of carbs, if you were to eat a bowl of oatmeal, or if you were to eat, a sandwich or a pizza or a bowl of pasta, you're going to release a huge surge of insulin. If you're eating, a couple cups of broccoli and some fish, you're going to release a small amount of insulin, almost none, but still some. So, but every time you eat, you release some insulin. And if we want to get your insulin levels down and help you become more sensitive to insulin, it's beneficial to have long periods of time where you're not eating at all. And that's where fasting comes in. So intermittent fasting can be helpful, where we stretch your overnight fast from 12 hours to perhaps 16 or 18 hours. And we can talk about how we stretch that. Sometimes we stretch it at the beginning. Sometimes we stretch it at the end. And then there's benefits to doing a full day fast, 24-hour fast, or alternate day fasting, where you take a full morning to night and not eat at all. And then there's benefits also to longer term fasts. And of course, each of these has to be matched to the individual client or the person that we're working with. But the bottom line is, long periods of time without eating allow your insulin levels to fall and allow your cells to become more sensitive to insulin. There's studies that show that when you're not eating, your insulin receptors actually become upregulated. And in fact, you may even produce more insulin receptors to try to help find more insulin. So all those things are beneficial, not to mention the other benefits of fasting, which include weight loss, increased fat burning, increased recirculation of damaged cells and protein, apoptosis. So it essentially helps the body rejuvenate, rebuild itself healthier, and all of those things are going to help blood sugar.
Okay, great. And so would you say that fasting really should be one of the foundational strategies that somebody with prediabetes or type 2 diabetes should take? And if so, what kind of precautions should somebody take as they begin to fast?
Yeah, I think so. I think if you look at diabetes as sort of an abundance issue, so it's an overabundance of food, calories, if you will, food, energy, and an abundance of insulin, which responds to that abundance of food, then doing the opposite, which would be fasting, really is probably the most effective method of reversing that. Now, there are a few precautions, as you mentioned. If somebody's injecting insulin, and that could be someone with type 1 diabetes, but many people, in fact, over half of all insulin prescribed in the US is prescribed to people with type 2 diabetes. So a lot of people with type 2 are on insulin also, which actually doesn't make a lot of sense, but it is common practice. So if you're injecting insulin, you have to be a little bit more careful with fasting, because once you inject that insulin into your bloodstream, your body can only detoxify it at a certain rate. So if you don't eat for days and inject insulin, your blood sugar could drop dangerously low, and it could be almost impossible for your body to bring it up itself. So we want to be careful in those cases. Also, if we're using medications that force the pancreas to release more insulin, there's a class of drugs, for example, called sulfonylureas that many people with diabetes are prescribed that basically squeeze the pancreas into releasing more insulin all the time, around the clock. And if you're doing that, that could be a precaution for fasting for the same reason that I mentioned earlier. People with eating disorders, we have to be a little bit careful with. People who, for example, have binged and purged in the past, it can sometimes trigger that same type of behavior if they're not careful, if they're not healthy and haven't dealt with whatever drove those issues to begin with. So I think that's something to be aware of. And then lastly, I would say people with other endocrine issues like thyroid or adrenal dysfunction that's not being treated properly. So somebody who has untreated hypothyroidism or severe adrenal fatigue, they could have a hard time with fasting, and I wouldn't necessarily recommend they do it. Pregnant women, children probably don't need to be fasting, and I'm sure they could, but that's an area that I'd be a little bit more careful with.
Yeah, absolutely. So really good guidelines there. And so what are some of the best fasting strategies that you've seen work with people with diabetes, and how do you kind of ease them into it? Like, what's your steps for how they can begin fasting? And then ultimately, what are the best strategies you like to use?
Yeah, one thing I tell my clients is that you're already fasting every day. So, a lot of people will say, I don't know if I could fast. And so, my response is, well, you're already doing it. So you definitely can do it. It's just a matter of extending that fast a little bit. So let's say they stop eating at 8 p.m. and then they start eating the next day at 8 a.m. So they just did a 12-hour fast. So let's try to make that a 14 or 16-hour fast. So you're just tacking 2 or 4 hours onto the 12 that you've already fasted. Really not a big deal. So that's a good place to start, is with intermittent fasting, where you just extend their overnight fast a little bit. So instead of breaking it at 8 a.m., you might break it at 10 or 11 or noon. And then when you break the fast, it's important. I also tell our clients that, yes, breakfast is the most important meal of the day. It doesn't have to be in the morning. It's whenever you have the first food, you're breaking your fast. So breakfast is really your first food, whether that's at 8 a.m. or 5 p.m. But how you break your fast is very important, because you don't want to break your fast with a load of 60 or 70 grams of carbohydrates. You want to break your fast with a really balanced, healthy meal. And so that's important. So we'll work on those two things. Once people feel pretty comfortable with that, then we can start doing strategic fasting. So sometimes we'll use something called early time-restricted feeding. Time-restricted feeding is the term used in the literature, in research, and it basically refers to the eating period as opposed to the fasting period. So time-restricted feeding would be eating between, say, noon and 8 or noon and 6. Or in early time-restricted feeding, you would eat perhaps from 8 a.m. to noon, or 8 a.m. to, say, 2 p.m., and then you would fast the rest of the day. And I found this to be really effective for insulin resistance, particularly people who have high morning blood sugars. So we see a lot of times people will have their highest fasting blood sugar in the morning. In other words, they wake up and their blood sugar is, say, 100, and then before they eat their first meal, it continues to climb up to 120, 130, and then when they eat, it'll actually come down a little bit. That's pretty common. About 50% of the people I see have that. Whereas if they take their blood sugar right before dinner, it might be 85 or 90. So that's called the dawn phenomenon, and it has to do with the dynamics of insulin and other hormones like cortisol, adrenaline, growth hormone, and glucagon, which all raise blood sugar. So in those cases, I found that early time-restricted feeding can actually be helpful, because if they try standard intermittent fasting, their blood sugar oftentimes continues to rise until they have their first food. So, for example, again, they might wake up and it's 100. If they don't eat until noon, it might be up to 140 or 150 before they eat their first food. And that's not healthy. So what we found in those cases is go ahead and eat first thing in the morning, but then stop eating at around 1, 2, 3, or 4 in the afternoon, depending on how long you want your fast to be. And then you're going to get that benefit of the intermittent fast without that rise of the blood sugar in the morning.
That makes a lot of sense. So that's one of your key strategies right there. How about like alternate day fasting, anything like that? Do you have any experience with that?
Yeah, so intermittent fasting can be helpful, but it's not really probably enough to reverse type 2 diabetes. If we want to do that, we really need to get the body in a fat-burning state and an energy caloric energy deficient state for a longer period of time. And that's where longer fasting comes in. Interestingly, if you just try to cut calories, like is often recommended, there's sort of this myth that if you just can snip off 500 calories or exercise a little more and burn 500 calories a day, more than you're eating, that, over a week, that adds up to 3,500 calories, which is about a pound, and you should lose a pound a week. It just doesn't work. The body is way too dynamic and smart for that, and it's going to adjust. So if you try to just cut down your calories a little bit, by 500 or 800 calories, instead of eating, 2,800 calories, you try to eat 2,000 calories a day. I found that the body just adjusts to that within a few days. The metabolism adjusts so that you are burning less. And that doesn't really work long-term for people. So sometimes we need to do something like longer-term fasting, because the body will never adjust your energy usage down to zero. It's impossible. In fact, really anything under about 800 or 900 calories per day is almost impossible. So you're going to burn at least that much every single day, even if your metabolism is running really, really slowly. So if you're fasting, you're going to burn more energy than you're consuming, period. There's no way around it. And sometimes that's what we need to do to get people to lower their blood sugar, lower their insulin, lose weight, and reverse diabetes. But just doing one day of that can be a little bit helpful, but doing more like 2 or 3 or 4 days of that or longer can be even more helpful. Now, you don't have to get down to 0 calories. You could get down to 200 or 300 or 400 by doing things like some bone broth and perhaps some lemon squeezed into your water and things like that. So you don't have to be purely water, but you want to be close to it if you really want to see the benefits for diabetes. So that's where the longer term fasts come in. We usually start people with intermittent fasting. If they're successful with that, we'll go ahead and do a 24-hour fast, which means they will eat at lunch and then not eat again until lunch the next day or dinner to dinner. And get them comfortable with that. And then we'll typically go to a 36 or 40-hour fast where someone perhaps eats dinner on Monday and then eats their next meal at breakfast or lunch on Wednesday. That would be a 36 to 40-hour fast. And then from there, we'll extend even longer if their body seems to be responding favorably to that.
Well, Dr. Brian, this has really been a great interview. You've given us a lot of just great takeaways, great strategies to use with diabetes, and really how to progress into fasting and strategies that people can be utilizing in order to get into that calorie deficit and start to get that insulin sensitivity. So any last words of advice for people, and also where can people reach you at?
Sure. Yeah. No, I would say that with fasting, fasting can be a great strategy, not only for short-term, but long-term health. And it's one of those things that we can all do. We all do it every single day. Don't tell yourself that you can't do it. You can do it. And it's just a matter of fine-tuning and listening to your body. I've oftentimes done fasting personally where I set off to do a 10-day fast, and on day 2 I just wasn't feeling it, so I pulled the plug. I stopped, I ate, and then I tried again maybe a week or 2 later. Listen to your body. If your body's not up for it, you're tired, you're stressed, it's just not the right time, then don't do it. Put it off and try again, but don't give up, because you can do it. You can be successful with it. And it does get easier as you fast more and more and longer. It gets much, much easier. Your body gets adapted to be able to do it. And it's natural. We fasted for as long as we've been around as human beings, and animals fast. Everybody fasts. So you can do it, and it's natural. If people want to find out more about me, it's drmowll.com, drmowll.com. I have a blog every single week. We have video blogs where we answer questions every single week. I have that podcast, which is Mastering Blood Sugar. They can find that at my website or iTunes, Google Play, Stitcher. Put in Mastering Blood Sugar, and we have some amazing guests on there. Great free education, great way to learn more.
Well, thanks so much, Dr. Brian, for being on. Definitely check out his podcast, check out his website. And remember that fasting helps unlock the dormant healing potential within you. It is safe, it's effective, it's inexpensive, and it's extremely powerful. You can do it. We'll see you on a future interview. Bye-bye.